Did you know that bladder cancer is the sixth most common cancer in this country? Most bladder cancer diagnoses, about 75%, are NMIBC, which stands for non-muscle invasive bladder cancer. Now, not everyone responds to the standard type of treatment for NMIBC, which may lead doctors to recommend surgery to remove the bladder. A different treatment approach may offer people with this type of bladder cancer more time before having to consider this radical type of surgery. Dr. Larry Karsh, along with patient Mike, join us now with more info on this. Gentlemen, thank you for joining us.
You're welcome.
Thanks for having us. Good morning.
Dr. Karsh, how common is bladder cancer? Who typically gets it? And what symptoms should we be looking out for?
So bladder cancer is pretty common. It's the sixth most common cancer in the United States. About 83,000 patients will be diagnosed with bladder cancer this year. It's the fourth most common in men. The typical symptoms are to have blood in your urine, which can look like a cherry red color, a rosé color, a burgundy color, or even a cola color urine. And you can have some urgency and frequency of urination and sometimes some painful urination. But at the time of diagnosis, about 75% of these patients will have NMIBC, non-muscle invasive bladder cancer. This is a cancer that grows in the lining of the bladder. So it doesn't go through the bladder or through the muscle.
And what traditionally has been the treatment for the high-risk early forms of bladder cancer, or the NMIBC? How is that changing now?
So the high-risk NMIBC, the traditional treatment has been BCG treatment, which is a weakened tuberculosis bacteria that's found in the vaccine. It's liquefied and placed into the bladder. But only about half of the patients will respond to this over their first year of treatment. If that happens, then the next treatment would be to consider a surgical removal of the bladder through a cystectomy. So a newer treatment that we have that we're talking about today is made by Ferring Pharmaceuticals, who we're here on behalf of. Adstiladrin is the first and only targeted gene therapy approved for non-muscle invasive bladder cancer in patients who have not responded to BCG. And you can have some side effects from this, which include urethral discharge, urgency and frequency of urination, as well as some blood in the urine and maybe even some fatigue. So if you are BCG unresponsive and have non-muscle invasive bladder cancer, speak to your doctor about whether this treatment is right for you.
Mike, let's move over to you now, and we appreciate, Mike, you sharing your story with us, too. Tell us about your diagnosis of high-risk NMIBC, and how are you doing today?
Yeah, it was about 8 years ago, and I was using the restroom at my office, and I noticed blood in my urine. This was shocking. I had never seen that before. I called my wife, and she recommended that I see the doctor as soon as possible. They were concerned it may be cancer in my bladder and referred me to a urology center in Colorado. They found a tumor, and I was diagnosed with NMIBC, the most common form of bladder cancer. Soon after the BCG treatment, they found that tumors had recurred. Being diagnosed with NMIBC was nothing compared to the devastation I felt when the doctors told me that I was no longer responding to BCG treatment. They presented me with the next best treatment, which was surgically removing my bladder. The thought of losing the bladder was terrifying, and I raised concerns. Fortunately, the doctor offered me an opportunity to participate in a clinical trial using an experimental gene therapy treatment. All I had to do was visit the urologist's office once every 3 months for administration directly into my bladder. Because it's gene therapy, I had no side effects, and I continued to work with no impact on my day-to-day life. I completed the program, and Dr. Karsh told me that there were no more tumors. This gave my wife and me an enduring sense of hope, knowing we could continue doing the things we love.
I can only imagine.
Thanks to Dr. Karsh and Ferring Pharmaceutical, I have been able to continue with life as normal.
Well, best of luck for you with that, Mike, and we appreciate that. Quickly, Dr. Karsh, where can people go to get more information on this?
So you can go to adstiladrin.com. It's ADSTILADRIN.com, and speak to your physician to see if this treatment is right for you.
All right, great information, especially for concerning people with bladder cancer. Gentlemen, we appreciate your time and thank you for sharing the information.
You're welcome. Thank you.
Thank you.